Good morning. Thanks for joining us to talk about COVID. As you know, we continue to follow the COVID-19 numbers on a daily basis. When looking at the data over the last 2 weeks, Southwest Indiana is clearly going in the wrong direction. If you look at the color-coded map that's provided on a weekly basis by the state, you can see that Southwest Indiana is definitely an outlier going in the wrong direction. Here in Evansville and Vanderburgh County, the numbers are going in the wrong direction specifically too. Just look at the graph and you see where we were in terms of new cases relative to each stage of the Back on Track plan, relative to the day opening of school, opening to Labor Day, and our numbers are going in the wrong direction. The question is why? Monday, when I visited with many members of the media, I talked about complacency and frustration being common denominators in the issue of rising numbers. Unfortunately, the virus oftentimes does not become really real to all of us until we know someone who has contracted the virus, or sadly, someone who has died because of the virus. When you look at the data from our state and local officials, two additional reasons for the surge are apparent. Large gatherings with little or no social distancing and no mask wearing, and employees of long-term healthcare facilities. When we take a deeper dive into the latest data from the District 10, the positive rate for tested individuals has increased for all age groups. All age groups. In particular, the 70-plus age group has the highest positivity rate, meaning those individuals who tested positive for the first time during that 2-week snapshot saw a significant increase in positivity compared to those tested earlier. Keep in mind that District 10 encompasses 12 counties, and keep in mind that we are the healthcare and commerce hub of the region, so that means many of those COVID patients are coming to the hospitals in Evansville. Now back to large gatherings and contact tracing. Health officials can determine specific events where an outbreak occurs, whether it's a social gathering, funeral visitation, or sporting event. If you were in close contact with someone that tests positive, you will be contacted and provided guidance on next steps to help in the recovery process. State Health Commissioner Dr. Christina Box reminded us yesterday in a meeting with our medical advisory group that stage 5 does not mean that we are in the clear. Restrictions are still in place. Currently, the state's Back on Track plan requires that any event with over 500 people must be approved by the local health department. Today, I'm announcing a more restrictive measure for the city of Evansville. Based on the data provided by the State Health Department, guidance from our County Health Department, and our local hospitals, the City of Evansville will reduce that number to 125. Here's what that means. Effective 1 week from Monday, October 19th, organizers of any social or civic gathering where the number of individuals in attendance is reasonably expected to be greater than 125 people, organizers will be required to submit a written plan to the Vanderburgh County Health Department 10 days prior to the event. Again, as a reminder, the requirement is already in effect for events over 500. We are reducing that number to 125. The state has previously defined social and civic gatherings like this. Any event involving the gathering of multiple persons from different households, whether indoors or outdoors, at the same time and in the same place to attend an event, including but not limited to weddings, ceremonies, family reunions, parties, benefits or fundraisers, fairs, festivals, carnivals, parades, community events, community holiday celebrations, conventions, sporting competitions, concerts, performances, and entertainment events. An event plan presented to the health department must outline the steps that will be taken to protect the spread of COVID-19 at those gatherings and shall address the following: providing COVID safety information for guests, identifying screening measures for staff, volunteers, and participants, outline social distancing plans, identify sanitation measures for the event space, provide face covering plans, and identify how compliance of COVID measures will be handled. We don't think these are onerous steps. We think these are important steps to help protect public health. The Vanderburgh County Health Department, as they have done in the past, may approve, deny, or make adjustments to the submitted plan. Healthcare providers have told us from the beginning that we put ourselves at greater risk of contracting the virus when we are in large crowds with limited social distancing and no mask wearing, whether the event is indoors or outdoors. So why 125? For contact tracing purposes, this is a manageable figure that works for trace investigators and supported by the County Health Department. The key is to have plans and protocols in place and that are adhered to. Now is the time to ask yourself if you really need to attend that party, reception, visitation, reunion, or sporting event. At the very least, proper adherence to CDC guidelines is necessary to protect yourself and others. As I mentioned earlier, Dr. Christina Box, the State Health Commissioner, was in Evansville yesterday. She came to review our trends with our medical advisory group. She is supportive of the measures that I am announcing today. Dr. Box also informed us that the state is sending strike teams to long-term care facilities around the state, including Southwest Indiana, to ensure COVID safety compliance. As I mentioned also earlier, stage 5 does not mean we are in the clear. There are restrictions in place. For instance, restaurants and bars that serve food may be open to full capacity as long as there is 6 feet of space to maintain social distancing. Indoor and outdoor venues can be at full capacity with social distancing in place. Senior centers and congregate meal sites may be open with those same precautions. We are all suffering from COVID fatigue, but now is not the time to let our guard down. We need to get a flu shot. We need to wear our masks. We need to practice social distancing, and we need to wash our hands frequently, and we need to avoid large crowds. We have a number of other folks who are here today to offer comments. I'd like to introduce the administrator of the Vanderburgh County Health Department, Joe Grease.
Good morning, everyone. As the mayor mentioned, the health department asked Dr. Box for additional information concerning contact tracing. We got that information, as the mayor said yesterday. It has a lot of information that shows where people are when they are out and about. It kind of gives us an idea of some of the clusters that have occurred. The mayor mentioned funerals, high school sporting events. We've seen clusters within family gatherings, high school kids getting together on the weekends at somebody's house, things of that nature. So all of that information came from Dr. Box from the State Health Department to us, helps us identify kind of what we already knew, but then also how we can maybe get that message out to these folks and make sure that everybody's protecting themselves as best they can by that social distancing, maybe not going to that gathering that has that many people. So the health department is very happy to be a part of this process. We will work with all organizations that may be having these gatherings. We will have questions. We will work with them on protocols and make sure that things can be done safely here in Vanderburgh County. So we do have copies of the report from Dr. Box for everybody as well today.
key to all the decisions we've made in the last many months has been input from the local healthcare community. We're really blessed, as I've said many times, to have extraordinary healthcare for our city and for our region. Both hospitals are represented here today. Dr. James Porter and Dr. Gina Hunke from Deaconess and Dan Parad from Ascension St. Vincent. We'll just go around the horn. James?
Thank you, Mayor. On behalf of the nearly 8,000 members of the Deaconess team who are seeing the devastating impact of this deadly pandemic on a daily basis, I just want to say thank you to Mayor Winnecke and the Vanderburgh County Health Department for having the boldness to do the right thing. This is about saving lives. We are not only seeing the number of cases increase and the number of people requiring intensive care and ventilator care increase, we're seeing the number of people in our community go up as a result of this surge. And while I'm sure there are people who will second guess this and not be happy about it, these are difficult decisions that are given great thought and consideration before they're taken, and Mayor Winnecke has consulted with all the right people, including Dr. Box, to try and make sure that he's taking the appropriate steps at this time. And again, I just want to say thank you for their bold leadership in trying to do the right thing to protect our community.
Yes, I would just like to reiterate what the mayor said. And the medical community is fully supportive of the ask for the gatherings to be limited to 125 persons. We know that people love their families, and we know that this is a hard time, but there are many other ways to connect. So please protect your families and yourselves by limiting the number of gatherings, and please continue to wear your masks, get your flu shots, wash your hands, and maintain that distancing. We know you've heard this message over and over again, but we want to reiterate the importance of this message during this time of surge. Thank you to the mayor for being bold enough to have this ask out to the community, and thank you to the community for listening and participating.
Good morning to everybody. I'm Dan Parad. I'm the president of Ascension St. Vincent here in Evansville, and I too want to just say thank you to the mayor, to the county health department for taking action. This is really important, and really since the beginning of this pandemic, I want to applaud the mayor on behalf of Ascension St. Vincent for being proactive, for really trying to understand what he can do, what the city can do to protect the citizens of our region, and it is so critical. I really would ask everybody who hears this to pay attention to the data, because the data that's available on the state health department website daily shows the data specific to our county and to our region, and it is not trending in a positive direction. And I believe that there's a lot of misinformation. Some people who think maybe the virus isn't that serious, or it isn't that prevalent in our area. Those things are not true. And as Dr. Porter said, we are losing our loved ones daily. And so on behalf of the health systems in your community and your region, we are asking everybody to take this very serious and follow all the precautions that we've been asked. And if we do that, we can turn this around. We can change the trend for Southwest Indiana, which will allow us to keep our loved ones safe, keep each other safe, allow us to continue our economic recovery. This poses a huge risk to our economic recovery of our region as well. So again, I just want to say on behalf of Ascension St. Vincent, thank you very much, Mayor.
So we are working on parallel paths. We're trying to follow the data on a daily basis and figure out what we can do to flatten the curve, but we're also looking to get more and better data and have even stronger communication with all of our partners. Deputy Mayor Steve Schaefer, as many of you know, has led the Reopen Evansville Task Force and has some information on that.
First off, thank you, Mayor, for your leadership in continuing to make data-driven decisions during the pandemic. Just a brief update. Since April, the Reopen Evansville Task Force has worked on many fronts to support the fight against COVID-19 while preparing us for life with the virus. In just about every meeting that I attend, it's always stated that no one wants to see a complete shutdown. And with that said, like the mayor said, on a parallel path to the Back on Track plan and the limitations on large gatherings, the task force remains committed to its charge. From the data and the counsel of our medical advisory group, the task force intends on assisting the health department in working with specific industry groups or sectors like we did at the beginning of the pandemic through workshops, programs, and other assistance. In our discussions, the need for enhanced contact tracing on the local and regional level is something that we've begun having discussions with our partners in Indianapolis. Our research with other cities that have taken this approach, in addition to the state's efforts, have benefited greatly from having real-time data for strategic decision-making. And just yesterday, we received about 30,000 new disposable masks to be used by city and other area organizations. Masks and other PPE supplies are being monitored and restocked. Our medical advisory group yesterday identified specific needs for their work, and the task force will attempt to aid them in their efforts as we head into the flu season. And lastly, I simply want to remind the public of the availability of COVID-19 testing. There's widespread availability. In addition to the hospitals, the free site, Optum testing site at CK Newsom is open 8 to 8, Monday through Fridays, and that option is available to anybody in the public. And for more information, we ask people to visit the website, www.reopenevansville.com. So appreciate the support by the medical advisory group. Once again, want to recognize Dr. Spear, Joe Grease, Lynn Herr with the Vanderburgh County Health Department, and everyone that's making this, making our work through the pandemic a little easier. Thanks, Mayor.
So to conclude, this new executive order, again, takes effect Monday, October 19th. By state statute and local ordinance, mayoral executive orders can only be in effect for periods of 7 days. I think it's likely to assume that we will extend it beyond 7 days at the appropriate time. I think it's also important to note this is not meant to be a punitive action. This is meant to really protect public health. And I want to close with a story from about a phone call I had earlier this week. Abraham Brown, as many of you know, leads Fiesta Evansville, and their event was scheduled for this Sunday. And he and his committee had gone to great measures to sort of reinvent it to make it more COVID friendly. And they had done a great job, but there were still risks. When Abraham and his committee heard my message on Monday, they felt really obligated to take a second look about whether or not to proceed. And they made a bold but I think correct call in postponing this year's event. And he was down only because he had worked so hard. But he was proud because he wanted me to know how much his committee wanted to support our city. And I told him that from the bottom of my heart, I really appreciated their effort, because I think that decision, and decision like that others can and will make in the weeks to come, will save lives. And that's ultimately what this is about. So with that, we'll be happy to take any questions you may have.
Mayor, was there any discussion about making this regional in scope? Of course, your executive order will only apply within the limits of Evansville, so it wouldn't be in effect, say, at North High School or McCutcheonville or Darmstadt, Warren County. Was there any discussion about trying to bring in some other municipalities?
We have had discussions with the County Health Department and Dr. Box about the regional nature of the numbers today. And we realize that while a mayor of the city of Evansville can't really influence that, those at higher levels can. And I would just tell you that there are ongoing, that gap is recognized, and there are people trying to figure out ways to fill that gap.
Mayor, I understand that large gatherings of more than 125, of course, can't happen with the approval of the health department. My question is, why not just go ahead and set that limit and cap it at 125 altogether?
Because there are ways, according to the health professionals, that you can have larger gatherings if there's a safety plan in place. If you're going to be at Wright's Bowl, you can have more than 250 people there and be socially distanced. It seats 10,000. The key is to making sure they're socially distanced. So there are ways to do things. If your venue is large enough and your plan is appropriate and the health department sees that you have all the proper protocols in place, we're not trying to shut people down. We're trying to say, listen, here, these numbers, these graphs, they're dramatic. And here's one thing you can do to help us.
You mentioned the Wright's Bowl. A lot of people might have questions about high school football in general. Does this apply for high school football, and does it include the players? I know their rosters have, quite a bit of guys on the sidelines.
So we have ongoing discussions. I've had 2 conversations this week with Dr. Smith. I know Joe and Lynn at the health department and Dr. Spear meet with them on a weekly basis. We'll see what happens in the days and weeks to come there. Dr. Smith has been extraordinarily open about their willingness to do what we think is the right thing. And on the other hand, we also recognize that people want to see their sons and daughters and nieces and nephews participate, and we want to be cognizant of that too.
Now, Mayor, right before this event here today, we got a press release from Commissioner Carol Musgraves. She was basically sort of insinuating that without feeling like there is concrete information out there from the medical community that maybe making a decision like this is preemptive. So I was just curious if you had a response to that.
I will tell you that the information that we have seen that has been available for months, and the information that we received yesterday from the State Department of Health, I think people would feel totally differently once they see that. And again, we got that information yesterday, and Joe has brought that over for everyone to have today.
We have a question from Steve Berger, WNIN. Are there any local events that are identified as spreader events?
So, yes, and that's a lot of the information that we got from Dr. Box as well. And I can just kind of go through maybe a little bit of it. When they looked at their contact tracing databases, they were able to identify several clusters, as they were called, here locally that had several different cases associated with them. There was, just an example, funeral home in Evansville, worship centers. There were 8 cases associated at a local worship center here. Also, sporting events, a high school volleyball team and sporting events. High school football team here regionally was also identified by Dr. Box and their team. We've seen it in community centers. They've seen it, the clusters again, country clubs, bowling alleys. There's several different others, even within bars and restaurants. There have been cases linked to these venues. Again, I think in certain situations, social gatherings, especially within families or people are close to, I think what we've seen and what we hear here locally is people let their guard down, and they don't maybe always have COVID in the front of their minds. So they may not social distance at a certain type of gathering, and they're not wearing their masks because it's, you may be grieving for a loved one who has passed, or at a wedding celebrating. So those types of things, I think, can be understandable, but we're asking that people really keep that in the forefront of their minds when they're possibly at these events, and really protect themselves and protect others by social distancing, wearing their masks. And if you're sick or if you have symptoms, please stay home and remember that's protecting somebody else.
Okay, I'll keep you up. keep you up there for a second. So I left out part of Steve's question. So what about political events? Have there been any political events tied to or that could be considered spreader events?
The local health department hasn't heard of any political events here locally or regionally, and there weren't any in Dr. Box's information, so no.
My next question is just, I understand this doesn't take effect until the next Monday, following Monday, October 19th. Did you all explore trying to put that in effect earlier than the 19th? Or
So
why is that?
here's the thinking behind making it effective a week from Monday. There are no doubt many people who have events next week or next weekend. And we thought, while it's important to get this restriction in place, we also want to be fair. And I didn't want a lot of event organizers scrambling in the next few days to get their event plan to the health department. It just seemed too cumbersome. So we want to give, especially those event planners who have organized events before the 19th, some relief so they're not scrambling too much.
My next question might be for Joe Grease, but this in regards to that review process, when you get that paperwork in from an event organizer, I guess, how thorough is that process going to be? Are we going to see a lot of these events be approved, or are we going to see a lot of them get shot down?
It's going to depend. I think what we're going to try to do is really delve into the details. We're going to ask specific questions, square feet of the venue. Is it inside? Is it outside? We're going to ask how many people obviously are going to be there, or how many you expect, how many volunteers, how many staff, if you're an organization, a business that is putting something on, that are going to be there to help go through and ensure things are being followed as far as the protocols at the event. So we're going to ask for a great deal of data and information from these organizers, and we're going to go through with fine-tooth comb, because if we don't, then we may be making decisions that aren't really affecting what we're trying to do here and limiting the numbers. We will also track data on this. We're going to put this into a format that we can then report back out to the mayor, to the health community here locally, to even Dr. Box, and show what we have done. And maybe there's another community or other counties that can maybe follow our lead here and take what we're doing and apply it in their situations as well. There will be. Okay. Yeah, so the mayor reminded me, we will have a form online. We're going to be creating an electronic form that people can fill out. They'll go to our website, probably put out a press release here early next week when that's available, so that people can start utilizing that. We have something in place. As the mayor said, we've been doing this when we were in stage 4.5 and now stage 5. It's just the numbers are going to look different. So, and we're going to tweak it a little bit again to make sure that we can track the data, track the information that we're getting, so that we can report back out on what's happening.
Joe, contact tracing data says that not only large gatherings are responsible, people are picking it up, restaurants, the store, what have you. If you go out to eat, if you pick up your groceries, well, I guess what I'm getting at is, should you continue to do those things? I mean,
so
even if you're following the basic guidelines that we're talking about?
Yeah, the contact tracing information that we received from Dr. Box doesn't necessarily show where people are getting it, maybe from a store or anything like that. It tells them that's where they were. That's where maybe a person who was a confirmed case have gone over the previous 14 days, so that if there is a cluster that builds up, they can then, that's what they gave us with the cluster information. So contact tracing information is kind of limited on looking at how a person may have contracted it. It's more about, let's identify those people who you are around in close contact, so we can have those people isolated as well. That's really kind of, I think, the focus. And again, at the state level, not everybody participates in that contact tracing. They contact everybody who's a confirmed case locally, but some people aren't participating. So we would ask that everybody participate in that as well. The more data we have and the more information that we get from people, it really just helps us kind of keep everything going in the right direction as far as getting people isolated and away from others.
This is for whoever would like to answer this question. I understand just certainly evident in the numbers. We've seen some restrictions that have been successful, others that have been not so successful. So I guess as a group, what makes you all feel like this will help us bring our numbers down in the region?
Well, I think first of all, there's no guarantee that it will, and that's one of the reasons we have to continue to watch the data. It's possible that additional steps will be necessary at some point in the future. I think the mayor and the advisory group have been trying to be very thoughtful about the impact of decisions like this that are made and the unintended consequences that sometimes come along with it. And certainly there's a concern for commerce and the economy as well. And so there's a balancing act of trying to make sure that we're doing things that have a reasonable possibility of having that impact down the road and then needing to monitor it. What we're seeing over time is there's about somewhere between 2 and 3 week lag between some change that happens and when we really start to see that evident in the numbers. So I think we're going to have to watch this over the course of the next couple of weeks. And that's another thing that I would just like to advocate for is, in addition to the limitation on the size of gatherings, which is going to be for a week and then likely renewed, if we as a community would just get together and say, let's really double down on wearing our masks and washing our hands. And if we did that for a couple of really solid weeks where when you went out to gatherings, you didn't see people, thinking, well, maybe I can slip it off and nobody will get upset. If we would all really double down on that commitment, I think the size of gatherings and us really being serious about mask wearing could make a difference and hopefully prevent further measures that might ultimately start to impact people's livelihoods and their ability to make a living. And that's just the last thing that I would like to add is, and back to the point of, is it safe to go to the grocery store? Is it safe to go out and do your business? It's becoming more and more evident as this pandemic progresses that mask wearing and hand hygiene are very effective at limiting the spread. And so I think it's when we get into those social situations where people think, I've got a drink in my hand and so I don't really necessarily have to wear my mask, that we're creating this environment for it to be spread. If we can get together, if we'll just stay a little spread out and keep our masks on, we'll be safe. And that's why it's okay to have a gathering of more than 125 people. It's not okay to have a gathering where people from different households and different small social circles are getting together, intermingling, not wearing these. That's where we're having the spread, and that's why we're in the situation that we're in. And I think just to the other question earlier with regard to the data, I think the data speaks for itself. That graph of the state of Indiana, for me, is like the Sesame Street game. One of these doesn't belong. I mean, you can look at Southwest Indiana and see we're sticking out with the rest of the state. And the other piece that we don't see when we look at Indiana data, but I think is important, is when you look down the entire I-69 corridor and the state of Kentucky's data, there's an orange stripe down I-69, and it really is that whole continuum up and down this Southwest Indiana, Western Kentucky corridor that has a real outbreak going right now. And to the point of this being a regional thing, I sure hope leaders in other parts of this region who are part of this outbreak see what's happening and follow the mayor and the health department's lead in taking some steps to try and mitigate it. If they don't, more people will die, and we will be back, unfortunately, I think, taking further steps which won't be nearly as pleasant as the one that we're recommending today.
Okay, thanks everyone. Have a great weekend. Stay safe.